We're witnessing a moment in medical history that will be talked about for decades. For the last 50 years, the medical textbook on spinal cord injury has been very short and very bleak. It essentially said, once the damage is done, it is permanent. We were told that the spinal cord, once severed, cannot grow back. But this week, a biotech company called NervGen shattered that dogma. They released data from their landmark Connect SCI trial that proves, for the first time, that the human nervous system can repair itself even years after a devastating injury. We aren't just talking about hope anymore. We are talking about data. We are talking about paralyzed patients regaining the use of their hands, their bladder control, and their independence. This is the story of the impossible drug NVG-291. To understand why this is happening now, we have to go back nearly 40 years to a lab at Case Western Reserve University and meet a man named Dr. Jerry Silver. In the 1980s, Dr. Silver discovered that the reason nerves don't grow back isn't because they die, but because they get stuck. He found that after an injury, the body creates a glial scar that releases a sticky chemical glue called CSPGs. He famously described it as flypaper. The nerves try to regenerate, but they hit this chemical wall and stop. Dr. Silver spent decades looking for a way to dissolve that glue. The breakthrough came when he found a specific receptor on the nerve. Think of it as a brake pedal that gets triggered by the scar. His solution, NVG-291, is a peptide that acts like a wedge under that brake pedal. It effectively turns off the stop signal, allowing the nerves to grow right through the scar tissue. But how did this science get from a lab bench in Ohio to patients in a clinic? That story starts with a tragedy. In 2016, Cody Darnell, a young mother and the daughter-in-law of Dr. Harold Punnett, fell and suffered a T11 spinal cord injury, leaving her paralyzed. Dr. Punnett refused to accept that nothing could be done. He scoured the globe for research and eventually found Dr. Silver's work. He realized this life-changing science was stuck in academia. So in 2018, he co-founded NervGen Pharma with a single mission: to get this drug to patients. Since then, NervGen has been moving at lightning speed. They licensed the technology, completed rigorous safety trials in healthy volunteers, and earned Fast Track designation from the FDA, a status reserved for drugs that treat serious conditions and fill an unmet medical need. All of that work led to the Connect SCI trial, the results of which we are seeing today. The data from this trial is stunning. The study focused on chronic patients, people injured for years who were told they would never improve. In hand function, patients treated with NVG-291 saw a 3.7-fold improvement in grasping ability compared to placebo. That's the difference between needing help to eat and holding a fork yourself. In bladder control, 67% of patients on the drug reported improved bladder control compared to just 22% on placebo. And with spasticity, more than half the patients saw a significant reduction in muscle spasticity. One participant summed it up simply: I can now take care of myself. Now, it is crucial to keep our feet on the ground. This was a phase 1B/2A trial, which means the group of patients was very small, only about 20 people in this specific cohort. In science, we need to see these results repeated in a much larger group to be 100% sure. Also, while the improvements were massive, this isn't a magic wand that instantly cures paralysis. It is a functional improvement, getting hands and bladders working again. But for the people living with this injury, that difference is everything. Dr. Jerry Silver's lifelong gamble has paid off. We're moving from care to cure. If you want to follow this journey and other medical breakthroughs, please like and subscribe. The future is looking incredibly bright.